Hi, my name is Simone Watkins, and I will be talking about how cognitive behavioral therapy is used to treat adolescent depression and suicidality. Okay, now we're going to talk about why this is important to look at. When I was looking at the numbers of adolescents and high school students who have experienced depressive episodes or who experience depressive symptoms, who have highly considered suicide, who have attempted, the numbers are pretty staggering. And I can only imagine that, especially in the time that we're in right now, that these numbers will continue to increase. So looking at this and knowing, you know, what to do, how to treat it, and different techniques is important. I was just recently talking to a colleague who is a principal at a high school, and she was telling me that she's had to talk to a lot of her students and, you know, in a sense, give them some sort of counseling in order to decrease all of these unhelpful thoughts, etc. Because they're so out of their routine. So looking at this is important. So right now I'm just going to read you off some of the numbers that I found, and this is based off of the year 2017 in Illinois. So 32% of high school students have experienced depressive symptoms. 17% reported highly considering attempting suicide. 10% reported attempting suicide one or more times. And 4% reported attempting suicide that resulted in an injury, poisoning, or overdose that had to be treated by a doctor. In Illinois in 2015 through 2016, 12% of adolescents ages 12 to 17 reported having at least one major depressive episode. And another just kind of intense fact is that suicide is the second leading cause of death behind unintentional injury in adolescents and young adults in the United States. Okay, this slide just gives an outline of the criteria in the DSM-5 for major depressive disorder. So this is just, what I'm talking about when I say experiencing depression symptoms or having a depressive episode. Okay, so now we are going to talk about cognitive behavioral therapy, also known as CBT. CBT is an evidence-based theoretical framework used to treat a wide variety of psychological problems, including depression, anxiety, self-esteem issues, etc. And it's built on the principles that our psychological problems are due to unhelpful or distorted thinking. They're due to learned patterns of unhelpful behavior, and says that people who are experiencing these psychological problems are able to learn healthier coping skills in order to alleviate these symptoms. Okay, now we're going to talk about how CBT is used to treat adolescent depression and suicidality. Adolescents, experience a wide variety of stressors, and these stressors can trigger depressive episodes and or suicidal crisis. So the CBT model suggests that these depressive episodes or suicidal crisis form from maladaptive cognitions, behaviors, and effective responses to these stressors. And the stressors can trigger cognitive distortions, making it more difficult to problem solve and regulate their emotions, which can lead to worsening of symptoms. So CBT treatment usually involves strategies and techniques in order to rework these thinking and behavioral patterns in order to decrease the depressive symptoms and or suicidal ideations. Okay, now we're going to talk about cognitive behavioral therapy for suicide prevention, and we'll call that CBT-SP. So CBT-SP is adapted from the traditional CBT in order to create a cognitive behavioral treatment for adolescents who attempted suicide in 90 days or less prior to treatment. The primary goals of this intervention are to decrease suicide risk factors, increase positive coping skills when dealing with stressors that may trigger a suicidal crisis, and prevent further suicidal behavior. CBTSP isn't really designed to address all of an adolescent's problems or stressors. However, it's focused on developing these cognitive, behavioral, and interactional skills in order to refrain from further suicidal behavior. So essentially, it's working towards helping an adolescent gain the skills to better regulate, their emotions when dealing with their stressors. So the CBTSP consists of acute and continuation phases that are completed within 6 months. The acute phase has an initial, middle, and end of acute treatment phase, then followed by the continuation phase of treatment. So CBTSP was adapted at my internship site in hopes of decreasing the suicidal behavior in those adolescent patients. All right, so now I'm going to get into what the phases look like. So the first initial phase of the acute treatment include a chain analysis of events associated with the suicidal crisis, safety planning to help clients remain safe and not engage in suicidal behavior, psychoeducation conducted by the therapist about the nature of suicidal behavior, depression, and discussing the importance of securing lethal means. And this is done individually and in family therapy. And addressing reasons for living and building hope, and a case conceptualization completed by the therapist. The middle phase of acute treatment include skill modules, individual skill modules, family skill modules, and session structure. And the session structure basically is just saying how most CBT treatments have a specific structure of how the sessions go. So then the end phase of acute treatment include relapse prevention task, which is in 5 steps, goes through preparation, review of the suicidal crisis, review of the suicidal crisis using skills, review of a future high-risk scenario, and debriefing and a follow-up. And then lastly, the continuation phase includes an explicit discussion about the end of treatment, review of successful coping skills that were learned during the acute phases, and goals that were accomplished. Okay, so now we're going to look at a few studies that specifically use CBT as treatment for depressed and or suicidal adolescents. So this first one, known as the treatment of adolescent suicide attempters, which we will call TASA, is a multi-site study that looked at 124 depressed adolescents who attempted suicide within 3 months of the study. So the participants were able to be randomized or choose between 3 treatment conditions. So medication management, which would include use SSRIs in order to treat depression alone, CBTSP, which is what I just talked about, alone, or a combination of the two. So SSRI treatment as well as the CBT-SP. Majority chose a combination. And this study was conducted over a 6-month period, including individual, adolescent, or family sessions. So it either followed the SSRIs alone or the CBT-SP phases that I talked about before. So at the end of the study, all the participants showed significant decrease in suicidal ideation. Approximately 12% reattempted suicide and 19% experienced a suicidal event during treatment. So, but however, it is important to consider some factors in those who reattempted suicide or experienced a suicidal event, such as higher self-rated depression, suicidal ideation, family income, greater number of previous suicide attempts, lower lethality of a previous attempt, history of sexual abuse, and lower family cohesion. So it could get kind of complex, but overall, it showed that all participants showed a decrease in suicidal ideation. Okay, and now we're going to look at another study that looked at specifically CBT. So in this trial, individual CBT was compared to an individual problem-oriented supportive therapy with adolescents immediately following a suicide attempt. The adolescents were randomized to either 10 sessions of CBT or 10 sessions of the problem-oriented supportive treatment. Each session included an assessment of suicidality, and the adolescents who were selected for the CBT were taught how to effectively problem solve and some skills surrounding that, and cognitive and behavioral strategies in order to help manage their stressors. So at the 3-month follow-up, both groups showed reduction in suicidal ideation and depression, and only 5% of adolescents reattempted during the course of the study. Okay, this last study that we're going to look at is for adolescents with co-occurring suicidal ideation or attempt and substance use disorders. And the study compared an integrated cognitive behavioral treatment to enhanced treatment as usual. So the integrated cognitive behavioral treatment included a 6-month active, 3-month continuation, and a 3-month maintenance treatment phase. The protocol included individual, parent, training, and family therapy sessions using a 2-therapist model. 1 therapist worked with the adolescent, and the 2nd therapist worked with the parents. The enhanced treatment as usual included psychotherapy services through community providers. And both the integrated cognitive behavioral treatment and the enhanced treatment as usual were offered medication management. So what we saw with this one was that those in the integrated cognitive behavioral therapy group had lower incidence of suicide attempts, fewer psychiatric hospitalizations, fewer heavy drinking days, and fewer days of cannabis use over 18 months. And fewer adolescents were still diagnosed with depressive disorder by 18 months. So all in all, as you can see by these few studies that we looked at, cognitive behavioral therapy is an effective way to treat adolescent depression with suicidality. Of course, it sometimes needs to be adapted depending on the individual client, such as there's trauma-focused CBT. We see that the cognitive behavioral suicide prevention, which is adapted from CBT. So it all depends on the client, but it is an effective way to treat adolescents with depression and suicidality.